Deblina Roy for the presentation. To introduce Deblina Roy, she is a faculty of psychiatry nursing at King George's Medical University, Lucknow. She had more than 40 publications to her credit, and her primary area is COVID and mental health related issues. She had two landmark publications related to COVID, which was these publications are cited more than 2,000 times. There are two publications that are cited more than 2,000 times, which are identified as important landmark article in that particular areas. Another area of interest is psychosexual disorders. So now I invite Deblina Roy to make a presentation on. Over to you, Deblina.
Yes. Hello and good evening to everyone. Thank you, sir, for your elaborate introduction. I feel very proud. Sujit sir is one of my teachers and one of my favorite teachers. So I would like to start my presentation today and talk about the lived experience through mass uprising due to death of resident doctor in Kolkata. So I would like to say that mass uprisings happen across the world, and it has been quite sporadic and something which we can see pretty soon across Southeast Asia, and wars are also continuing. And apart from that, even in Europe, South America, so India is also not left behind. A recent mass uprising was observed in Kolkata, West Bengal, after a gruesome murder and rape on 9th of August 2024 of a female resident doctor in Arjical Medical College, Kolkata. This led to a nationwide protest from medical community and healthcare workers advocating for safety and security at workplaces. So here I'd like to discuss a bit about the case overview, which has been rolling on the national media of India and currently in the state media. This detail started circulating on WhatsApp groups and personal communications after the 9th of August, and it took momentum when the media started reporting the case. The details with the pictures started to be circulating in the groups, including the post-mortem report. FIR was not being accepted in the beginning, and that was reported by the media. So let's look into the state of West Bengal. The geopolitical position of West Bengal is it's situated internationally between Bangladesh, Nepal, and Bhutan. And neighboring states are Bihar, Jharkhand, Orissa, and Assam. So it's a state which is surrounded by a lot of other international borders as well as state borders. Also hosts a population of more than 91 million people. And the density of population is one of the highest in the country, that is more than 1,000 people per kilometer square. So culture of West Bengal has been a well-known place. It has been known as Bangla. It has been divided many times. It has a colonial past. And in the post-colonial era also, it has been recognized as a state for culture, art, and education. Historically values women and worships the goddess Kali, Durga. So women here are considered more empowered than the other states of India. And it's also a state which pioneers in women education and women empowerment in India. And we also have a lot of stellar, legendary people like Swami Vivekanand. They all belong from West Bengal. So it has a very colorful, nationally important cultural past. And let's look into the history of medical education in West Bengal. So West Bengal was the state which got the first medical college for Indian diaspora, which was in 1835, so that the native people could be trained in modern medicine. Kadambini Ganguly, a Bengali Brahmo lady who became the first Indian woman to be admitted in a medical college for the study of medicine, which shows us that how women have come forward across the ages in the state, and their empowerment has been there since more than 200 years. I myself graduated from a school which was established in 1905 in a very rural area of West Bengal. And then the medical college, which is in highlight, the Arjical Medical College, was Campbell Medical School, and that was Carmichael Medical College. and founded in 1886. Then there was Presidency Medical College, established for the British in 1770. So Calcutta hosts a lot of multicultural population, and it is considered to be one of the safest cities for women. Myself lived in the city for more than 6 years, have had a very uneventful and a happy and a safe life. But then when this news came up, the grueling details started coming up on the news and the media. So the first impression that came out for the people who were there was fear for safety. Oh my God, how did this happen? Calcutta is not an unsafe city. We have traveled across, we go in public transport, and this has never happened. So there was a matter of concern. How did this happen? What happened? What was the situation? There was a lot of concern about the security. Now, how come this place has become so unsafe for people, especially somebody who is in on duty in their workplace, and a metropolitan city which is considerably safe considered for women? Then newspaper reports, I'd like to highlight a few things. Post that, protests started happening. People, the doctors, the resident doctors of the medical college and the staff started demanding safety at the workplace. And as you might have been aware, that the FIRs was not being taken initially. So the government gave a sense of security. They had directed that fast track trial will be taken, and it's a despicable crime. And Kolkata police says that there's nothing to hide. Everything will be checked out, and that's what was initially promised, and it felt safe for people. So people felt that okay, this is going to be dealt with harshly and soon. But then grueling details started coming out, and not much had been achieved in a period of time. So as the days passed, on 14th of August, what happened? The doctors were peacefully protesting, and a day was called to claim the night. So the women of Calcutta came on the streets to claim the night, so that that night is not an unsafe place. But that thing became a huge hall, and a mob had attacked the emergency of RG Corps and vandalized the place where the grueling crime took place, as well as vandalized and hurt the resident doctors and the staff and the security personnel who were employed in that area. So the mass uprising started then. The media started flashing the news. People started getting aware. The other medical organizations, the resident doctors organizations, associations, Indian Medical Association, nursing associations, they started coming up that this is just not a death of a resident doctor. This is a safety concern for all the healthcare professionals in the country, and which took momentum. People started realizing the gravity of the incident. Safely protesting doctors faced vandalism and injury by a mob. 14th August, more than 1,000 people hurled the protesters. Lathi charge was done, and it took a very chaotic mob turn. The other professionals across the country also joined in. The nursing organizations, the paramedical professionals joined in solidarity and highlighted the importance of safety and risk associated with the shift duties and rampant risk associated on and off campuses. The transfer and shuffling. So after this, what happened? The administration took notice to it, and they started transferring the doctors who were protecting or supporting the protesters, and transfer started being allotted so that there could be a rift that could be created, which could mark some discrepancy in the situations. And I have highlighted a few news articles where we strongly condemn the Chief Minister of West Bengal, Mamata Banerjee, to transfer the faculty members who supported the protests. And people started saying, we'll not silence our demands, and justice and united front will be put so that the needs are not ignored for the health professionals. So here what I have tried to do is that the incident was very horrific. It felt like only the healthcare personnel were affected by it, which also indicates that even if it was a woman's issue, the doctors, the healthcare professionals quite felt stranded, that other people did not come forward. Although there was support in the West Bengal, but across the nation, if we look at the amount of support, it didn't feel as if other people were that much bothered about the situation. The resident doctors associations took a step, medical faculty associations took a step, nursing and other healthcare professionals came forward. Due to relentless protests nationwide, the government was forced to take the matter seriously, and the Supreme Court of India took cognizance of it. So now, as we can see, I've tried to show it as in the thing happened in Kolkata, which was the epicenter of an earthquake, but the waves rippled across the nation through the medical colleges and whatever clinics for the healthcare professionals. Some people used this opportunity of silent protest but carried out hooliganism in the emergency department in RG Kar Medical College and Hospital. Similar reports had come out from other hospitals sporadically because the protests were ongoing. Some of the services were cut short to tell or to express the solidarity with the thing that had happened in Calcutta, but people didn't understand. They demanded and they did not support the cause. That's what it felt like during the uprising. Public meetings and celebrities came forward with messages in the media. Here, I've also highlighted one news report that even if the thing happened in Kolkata, across the country, many medical colleges and hospitals were closed down only to the emergency services. Rest of the other services were rescheduled or postponed to stand in solidarity and to demand action for the protection of healthcare professionals. Political involvement took place. So when this started happening in West Bengal, there was a rift between the ruling party as well as the opposing party. So the blames were shared on each other, threats and derogatory remarks, leading to suspensions, apologies, and protests continued. And it is still continuing. The doctors, the Resident Doctors Association, the Medical Association also went and tried to have some talks with the Chief Minister. There were rifts in between them. Initially, they were hurled out. A lot of police directed violence also happened during that time, and there was this demand that the protection should be provided by the central forces and not the police. So there was the sense of loss and mistrust which was developing during that stage. So in the state of West Bengal, what we can see, the mental health impact was there was a huge conflict that related to fear, uncertainty, confrontation, and we can see that allegations were put that the evidence has been tampered, the place of crime had been vandalized, the state judiciary took cognizance of the matter, and hearing was started immediately. The outcry of the protesters was taken into suo motu cognizance by the Supreme Court, and police threatened and charged the protesting healthcare workers. The Supreme Court also issued reassurance that the case was handed over to CBI, which is one of the largest investigative bodies of the country. To deter the protesters, the state threatened to take adverse actions on the people who were doing the protests and as well as taking care of the patients. So a flood happened in West Bengal right afterwards. The doctors, they all went back to their duties. They started working. The healthcare professionals resumed their duties to help the flood affected victims, but support wasn't the way people had assumed it would be. The mental health impact is multifold of this uprising. It's mostly regarding the women's safety and empowerment. This is what it says, that a woman inside their workplaces feel unsafe. Although India has a few laws that protect women from harassment or difficulties in workplaces, but it feels as if that law hasn't been enforced quite strongly. The responsibility of the state government regarding the women's safety. The place of duty, in fact, was middle of one of the most populated cities in the world. Nobody can say that this is an isolated place. It might be unsafe, doesn't have many people. Why did anybody not notice what was happening or going on? So all these kinds of things didn't make sense for this incident to happen. Echoes that of the event continue to be discussed in the halls of medical colleges in India today as well. The people's concern about the judicial process, on the 13th of the August, the court, unsatisfied with the progress of West Bengal Police Department, handed over the investigation to CBI. The National Task Force was created to draft an SOP to prevent such incidents from happening on 14th of August. CISF and CRPF, Central Forces, were appointed to provide security in the hospital. Can you imagine? It is a public place, one of the places where sick people come to take help. The staff needs to be given protection by military forces. So the condition wasn't good at all. People responded with sigh of relief after this and started working on the SOPs. The people of Kolkata are still continuing their demand for justice and following the case closely. A few more bills that were passed by the government to counter such kind of acts so that these things don't happen commonly, that they said the law would fast track the punishment and convicts without parole, especially for rape and sexual assault. The another thing that said that these kinds of crimes will be judged within 20 days, 15 days extendable, so that the justice is not delayed for the victim. And West Bengal Junior Doctors Federation organized a sit-in in Swasthya Bhavan, which is the Ministry of Health for West Bengal, after ignoring the court order, because still they couldn't see the progress, they couldn't feel the progress. Negotiations continued. Finally, a meeting was held with the Commissioner of Police, and Deputy Commissioner was removed from their respective positions because people didn't feel safe for themselves. And this was all done by the protesters, who were mostly students. Personal experiences: being a woman in healthcare, the first feeling was of fear, paranoia regarding the safety at workplace. How am I supposed to feel okay working here? There's nobody to protect me. I can be harmed by anyone. Who can be the perpetrator? I have no clue what somebody might be thinking. Anger and disgust towards the perpetrators and the West Bengal authorities for the delay in taking action. Mistrust in the police. If the police themselves were not taking the FIR, they tried to dismiss the case, manipulate the evidence. Such kind of news reports were coming in from RG Kaur, definitely created a mistrust in the police. Fear regarding tampering of evidence by friends and acquaintances who are living in Calcutta. Remembering RG Kaur during my own postings and exam centers. So all of my undergraduate postings and exam center used to be RG Kaur Medical College and Hospital. And I still remember vividly how that used to go. And I used to love that. We used to go to the canteen. And it was such a safe place for me 7 years back. Feeling the failing trust and the sorry state of affairs of my state and one of the best medical colleges of India. What happened to the students who were in RG Kaur? Definitely there was fear, there was uncertainty, there was disbelief, there was loss, grief, and pain, and a huge amount of trauma. That would definitely require mental health support, wherein they can process the grief because they were friends to the doctor who died. They had studied with her, she had taught them, and their personal relationships. They might never be able to forget or get over the trauma that happened, the vandalism in the emergency, hurting of the patients, being lathi charged by the police who were supposed to protect them during their silent and peaceful protests. Impact on the state institutes across the other institutions. More such incidents continue to happen, but do not change the scenario. Something, even if it comes up now, doesn't take that much momentum and people sideline it after a few days. Only healthcare professionals were seen placing demands as if women's safety is not a social business. That was quite hurtful for the people who were protesting, and the healthcare professionals felt isolated in their stance during this uprising. There was a division observed among the protesters itself, and some people actively participated in the protests, but many refrained, creating a conflict within the same group of healthcare professionals. Internal comparisons and intergroup comparisons were drawn, like who is with us, who is among us, why is people not coming forward for this cause. Undercurrent of differences exist, creating hostility in the workplace and in the education